Hello, my name is Anika Blackmore, and the other members of my group are Brendan Sholer and Sam Taylor. We will be presenting the disease necrotizing fasciitis, otherwise known as the flesh-eating disease.
Necrotizing fasciitis is a serious bacterial skin infection that spreads rapidly, killing the connective tissue around muscles, nerves, fat, and even blood vessels. This disease can become deadly in a very short amount of time and requires immediate medical attention. The bacteria responsible for necrotizing fasciitis is Streptococcus pyogenes. Necrotizing fasciitis is mainly caused by Streptococcus pyogenes, which typically causes strep throat. However, other known bacteria that have caused this disease are Klebsiella, Clostridium, Escherichia coli, Staphylococcus aureus, and Aeromonas hydrophila. This bacteria has a positive gram stain result, and when looked at under a microscope, it has a morphology of Streptococcus. This means that it is spherical or oval-shaped, and these bacteria are typically linked in a long single-plane chain. This bacteria is non-motile, and although necrotizing fasciitis is known as the flesh-eating disease, it doesn't actually eat your skin. It releases a deadly toxin that breaks apart the fascia in the body. Streptococcus pyogenes do not produce endospores. The Streptococcus pyogenes bacteria is covered with a spiky surface of fimbriae known as M proteins. These M proteins help aid the cell in resisting phagocytosis. Also located on the outermost part of the cell are various surface antigens. Streptococcus pyogenes also have a capsule made up of hyaluronic acid, which contributes to adherence. As part of the cell envelope, Streptococcus pyogenes have a cell wall made up of peptidoglycan, which gives it a strong structure, and a cell membrane made up of a lipid bilayer. The innermost part of the cell consists of cytoplasm, ribosomes, a nucleoid, and a chromosome containing the cell's genetic material. Necrotizing fasciitis is a very rare bacterial disease that most often occurs randomly in nature. Humans are the primary reservoir for this disease. However, cattle are also known to be a reservoir for this disease.
Hello, I'm Sam Taylor, and I'll be talking about how necrotizing fasciitis is transmitted and what the symptoms it leads to. Transmission of the infection seems to be random, but it is always accompanied with an open wound. The wound can come from simple scratches, bug bites, or cuts. It can also come from more serious wounds that accompany surgery, accidental punctures, and even childbirth. Just because you get a cut does not mean you will end up with necrotizing fasciitis. The biggest factor is if Streptococcus pyogenes, the bacteria responsible for the infection, is present in the wound. Middle-aged individuals between the ages of 38 and 44 years are more likely to get the disease, and men are 3 times more likely to contract the disease than females. Necrotizing fasciitis has to have some way of entering the body. Usually this comes from a small break in the skin, an insect bite, or a scrape. The initial symptoms do not feel serious and are often confused with a pulled muscle where the skin is sore, warm, and red, and it then rapidly spreads. Initial pain then intensifies, which to an abnormal amount for the severity of the original injury. After the fever, chills, and vomiting set in. If these symptoms occur within a short time of getting an opened wound, seek medical attention immediately. This infection is very aggressive and can move up to an inch an hour, leaving behind dead tissue. The name necrotizing fasciitis literally translates to death of tissues. After that, the infected area will then swell and can burst, which leaks yellowish cloudy fluid. At this point, the pain will subdue. This means that the nerve has been affected and has already begun to die. Ulcers, blisters, and black spots then appear on the wound and spread as the infection moves through the body. With the spread of infection, the original rash turns from bright red to purple and finally back to black, which signifies that gangrene has begun to set in. Once gangrene has set in, organ failure and death can be imminent.
Hello, my name is Brendan Sholer, and I'll be talking about prevention and control, treatments, and interesting facts about necrotizing fasciitis. Most cases of necrotizing fasciitis have been rare and mostly random, but preventing infection from necrotizing fasciitis by proper sanitation practices and immediate first aid to even the smallest of injuries can lower your risk greatly. Some ways of lowering your risk of being infected is to always wash your hands with soap, and if soap is not available, use an alcohol-based rub. Drain wounds, clean and sanitize them, and apply a clean dry bandage to the site of the wound. Avoid spending extended amounts of time in swimming pools, hot tubs, or natural bodies of water if you have an open wound. Those with diabetes, kidney disease, cancer, alcoholism, and anyone with a weakened immune system are at a higher risk of infection. As soon as diagnosis comes back positive, immediate surgical intervention is required. Surgery is effective for removing any dead or infected tissue from the body. IV antibiotics such as benzopenicillin, also known as penicillin G, aminoglycosides, or clindamycin, should be administered to the patient as soon as possible. Penicillin is very effective against gram-positive bacteria because of its ability to prevent the cell from creating a new cell wall and dividing. The penicillin stops the cell from synthesizing a new cell wall, causing it to rupture and kill itself. Aminoglycosides essentially prevent the cell from creating a ribosome. If the cell doesn't have a ribosome, it cannot create proteins which are essential for the cell's survival. Clindamycin is most effective against aerobic gram-positive cocci, such as members of the Staphylococcus and Streptococcus genera. It works in the same way as aminoglycoside by blocking the bacteria from making proteins. Antibiotics are an important part of the treatment, but because the infection leaves behind dead tissue, blood circulation is reduced and the effectiveness of antibiotics is limited, so surgery is also required to help remove the dead tissue and allow the antibiotics to stop the infection from spreading. Another helpful procedure is called hyperbaric oxygen therapy. This is an oxygen chamber filled with air at 3 times the normal pressure. This allows your lungs to gather more oxygen than if you were breathing pure oxygen at normal air pressure. This procedure helps your blood carry more oxygen to your tissues to fight off infection and promote healing. Although, if the infection damages too much tissue, then amputation will need to be performed. The mortality rate for necrotizing fasciitis is between 25 to 30%. The earliest discovery of this disease dates back to the 5th century BC by Hippocrates. Necrotizing fasciitis was later found in the United States in 1871 by Joseph Jones during the Civil War. Jones observed cases of this disease, and it was thought that the necrotizing bacteria was caused by venereal gangrene. Unfortunately, venereal gangrene was restricted to the genital area, so Jones's observation was incorrect. In the 1920s, Surgeon Franklin L. Melanie characterized necrotizing fasciitis after examining 20 patients from China who were afflicted with the bacteria. Later on in the 1990s, this disease was given the name flesh-eating bacteria by the media, and ever since then, the name stuck. There are only 600 to 850 reported cases of necrotizing fasciitis in the United States per year. There are some famous individuals who have contracted this infection, and I will name just a few. In 1997, Ken Kendrick, who is partial owners of the San Diego Padres and Arizona Diamondbacks, contracted this disease. He had 7 surgeries in as little as a week, but fortunately was able to recover. Eric Allen Cornell was the 2001 Nobel Prize winner in physics, but in 2004 was infected by the flesh-eating disease and had to amputate his left arm and shoulder. Alexandru Marin, an experimental particle physicist and a professor at MIT, Boston University, and Harvard University, contracted the disease and unfortunately lost his life to it. In 2011, Jeff Hanneman, a guitarist for the band Slayer, contracted the disease. He died 2 years later on May 2, 2013, and people speculated that he died from the disease, but after proper investigation, the actual cause of death was liver failure due to alcohol abuse. This is the conclusion of our presentation on necrotizing fasciitis. The following is a list of the references that were used for the information and pictures.